Here we'll talk about idiopathic thrombocytopenic purpura, ITP. It is an antibody mediated immunological destruction of platelets. See, it is an autoimmune disorder where our own immune system attacks our own platelets, and it is antibody mediated. That means antibodies are formed against platelets. So it is the most common form of thrombocytopenia. It is an autoimmune disorder which autoimmune destruction of platelets occurs. Hypersensitivity type 2 reaction is seen. IgG type of antibodies are formed against platelets. Coming to pathogenesis, antibodies are formed against platelet antigens. So this antigens antibodies cross react, immune complexes are formed, and platelets get attacked by the antibody. Classification is again of two types. One is acute ITP and chronic ITP. Acute is seen in case of kids recovering from the viral illness. Their body already has antibodies which are formed against the viral antigen. Now this viral antigen is similar to the platelet antigen. So these antibodies which are formed against the virus attack the platelet antigen. There will be the cross reaction between the antibodies and the platelet antigen. Immune complexes are formed, immunologic platelet destruction occurs. Self-antibody destroy platelets. That means autoimmune disorder. Coming to the clinical features, it is sudden in onset, petechiae, gum, bleeding, epistaxis, fever is seen. What is the function of the platelets? It prevents the bleeding, right? It favors the clot formation and prevents the excessive bleeding. So in case of platelets destruction, there will be the excessive bleeding from the gums or epistaxis, etc. Self-limiting disorder. This acute immunothrombocytic purpura is a self-limiting and resolved within a span of 6 months. Here the platelet count is decreased as it is destroyed by the antiplatelet autoantibodies. Coming to the chronic ITP, the thrombocytopenia present for more than 6 months. The cause is idiopathic, so the name idiopathic thrombocytopenic purpura. Secondary causes can be lupus, AIDS, most commonly seen in the females of the reproductive age group 20 to 40 years. It's also seen in males but most commonly in females. Clinical features: abnormal bleeding, petechiae, hemorrhage, epistaxis, melena, hematuria, hepatosplenomegaly, menorrhagia. Menorrhagia is a common feature seen in females with chronic ITP. Laboratory diagnosis: here also the platelet count is decreased, obviously, and bleeding time is prolonged because of the less platelets, and autoantibodies formed against the platelets can be seen through the Combs test. Treatment: give them the corticosteroids, platelet transfusions should be done, and immunosuppressive drugs should be given. Splenectomy done in case of splenomegaly.